Namaste, I'm Dr.Siri, fertility expert with more than 15 years of experience practicing at Karuna Fertility and Maternity Center, Nagarbhavi, Bengaluru. So what is cosmetic gynecology? This is a new field which has gained importance of late. This is a specialized field of gynecology which basically deals with the aesthetic, functional and regenerative part of the female genital tract. This addresses the concern related to the appearance, comfort and function, thereby adding the quality to a woman's life. Who are the people who have to get these cosmetic gynecology procedures? Since the cosmetic gynecology is not just aesthetic or for appearance purposes, it has other uses as in functional and regenerative aspects also. So for aesthetic purposes, when we say we are talking about appearance, so it could be a hyperpigmentation of the genital tract or even a labia which is disproportionate or larger, so that could be the reason. And there could be many other aesthetic or appearance purposes for which we can do the cosmetic gynecology procedures. And when it comes to functional, yes, somebody could be having repeated infections because of that, or they could be having these small warts or growths or skin tags which could be coming in the way, or there could be certain abnormalities where their sexual pleasures they are not able to enjoy, or these are the functional reasons. And coming to the regenerative reasons, during a post-menopausal time, there could be that the vagina is atrophied or there is dryness and there is repeated infection, because of which we can do certain procedures which will improve their quality of life. And certain other indications, as in for functional, there is stress urinary incontinence, and sometimes there is a vaginal rejuvenation procedures that we do which will improve their sexual life and their self-confidence. So these are some of the indications. Cosmetic gynecology procedures may be broadly divided as surgical and non-surgical. So there are many procedures done under surgical. So that could be like labiaplasty, vaginoplasty to tighten the loosened vaginas, and the labiaplasty is to remove the excess labia which is protruding, or if there is discrepancy in the sizes of the labia, the surgeries may be done. There's something called hymenoplasty where we suture and give an hymen which is probably torn because of whatever reasons. We could restitch it and give a hymen. And there are other surgical procedures which were done like clitoral hood reduction. So sometimes the clitoris is hidden and the woman may not be experiencing the sexual pleasure. In that case, we could do the hood reduction and help. And sometimes the surgical procedures like wart removals or skin tag removal may be done. And some non-surgical procedures majorly we use here are lasers and PRPs. In lasers, when we do these vaginal rejuvenations, and sometimes for stress incontinence laser may be used, and even for labial rejuvenation, especially post-menopausal where the volume feels reduced or sunken, then we can do the laser to enhance that. And there are these biofillers or PRPs which we inject into the vagina or the labia to enhance its appearance and the functionality of it. So these may be done, and sometimes even Botox injections where some women might be experiencing painful intercourse. We can give Botox injections in order to release those abnormal muscle contractions and help her relieve the pain during intercourse. And even lasers may be used for hair removals. They are the painless ways of getting a hair removal done. And there are lasers and for hyperpigmentation of that area. So some women might be having hyperpigmented labias. We can use laser and we can do peelers to just improve its aesthetic appearance. So these are some of the commonly used procedures. So there's a multiple scope for all of this. These are some of the procedures we are doing at cosmetic gynecology.